and it moved while she was breathing. So if you think about it, one good sneeze and all her front teeth would fly.
Greetings, future dentists.
Hi, I'm Dr. Hannah Ramos.
My name is Dr. Alexander Galvan.
I am Dr. Erika Castro.
My name is Cleneth Dumadag.
My name is Dr. Trishna Gwenevir Santos.
My name is Elise.
This is your Dr. Marcaida.
I am Dr. Abelardo, and we are here to answer a few questions about periodontology.
In periodontics, we deal with the surrounding structure supporting the teeth. This is called the periodontium. This comes from the words peri, meaning around, and odons, meaning tooth.
Periodontics, just like any other branch of dentistry, went through a lot in order to develop into what it is today. Actually, several ancient civilizations already had a concept to what periodontics is.
The periodontium is divided into 4 major parts: the gums, the jawbone, the cementum, and the periodontal ligament. In addition, some people only care about their actual teeth and forget the importance of their gums, which also helps support and hold their teeth in place. We, as periodontists, focus on preventing, diagnosing, and treating diseases on your gums to make sure that your oral health is at its best. Just imagine if our gums would become weak, there's a huge chance that our teeth could become destroyed or could even fall out. And we wouldn't want that to happen, would we? This is why periodontics is very important.
One of the earliest texts about periodontics would date back to 5000 BC, where the Sumerians described the gingival disease as a disease of the periodontal tissue that people at that time were already suffering from. Other than the Sumerians were the Egyptians, who also had records containing prescriptions for strengthening the teeth and gums on their medical papyri. It contains several information on the herbal herbs that they were using, like honey, mint, and salt, as well as medical invocations such as amulets and curative devices. Other notable civilizations that recognized the existence of periodontics or oral hygiene are the Hebrews, ancient India and China, the Greeks, and the Romans. And despite using what many call as primitive tools or devices, the dental experts during these early civilizations were already ahead of their time, as they continuously treat and prevent these periodontal diseases.
Majority of the tools and equipments used became the foundation for the growth and development of dentistry. Periodontics continued to evolve throughout the Renaissance period, then the 18th century, where Pierre Fauchard, a French surgeon known as the father of modern dentistry, made necessary changes for dentistry to be a known profession and not just a primitive practice. The 19th century and 20th century then witnessed a significant increase in practitioners as well as the development of technologies and research about periodontics.
Well, you may say that I'm a bit of a dreamer. I was inspired to become a dentist because I want to give more reasons for people to smile. Cheesy, I know.
That's a tough question. Why did I take this? I mean, honestly, it's probably because I've been groomed to taking dentistry since I was a kid. I mean, I can't speak like a dreamer the way our Miss Universe over there just did. I was conditioned using practicality, basically.
And as I became a dentist, I realized that above all, I want to help improve the daily lives of my patients. As a periodontist, I help people overcome difficulty in speaking and food consumption by restoring their oral health, especially with the gum disease, bone loss, and missing teeth.
I was a rowdy kid with a very short temper and attention span, so when they told me that I'd never get bored of dentistry, well, I was sold there. Periodontics though, I guess I've had years of bleeding gums, so I suppose this is me returning the service done to me to others.
Don't worry, We promise it's really easy to apply to become a periodontist. You just have to have some qualifications. I mean, it's just a few requirements. How hard can it be?
Actually, those simple qualifications include finishing the 6-year dental program, passing both the theoretical and practical dentistry licensure exam, and then getting your license. All those are just part in applying for becoming a periodontist. But after all that, you must also take a 3-year Master of Science in Periodontology program. So, it's not that easy.
I took my Doctor of Dental Medicine degree at the University of the Philippines and then attended postgraduate studies at the University of the East Manila, where I specialized in periodontics.
Just like the others, I also graduated with a degree of Doctor of Dental Medicine at the University of the Philippines, Manila. In our country, there is actually a limited selection of schools that offers a masteral course in periodontics, and I took mine at the University of the East Manila.
Honestly, it makes me sad that some of my friends and colleagues have to go abroad and take their specialty there because of the lack of dental schools offering such courses in our country. To give you an additional information, some of them actually went to Asian universities rather, like the University of Hong Kong and the University of Malaysia, while others preferred to study in Western universities such as the University of Queensland, Boston University, and Queen Mary University of London in the United Kingdom.
And aside from that, I also think Central Escolar University is also a great choice of school where you can take the same program.
I work in a clinic in Makati, and I encountered a female patient who had a severe case of periodontal disease. So basically, her teeth were being held by her calculus bridge. So when I removed the tartar and the plaque from it, her teeth were basically dangling in her mouth.
I think it would be quite impossible for me to pick just a few experiences because if I'm being honest, there are a lot of notable experiences. But in general, I think it would be every time I see the joy in my patient's smiles.
And it moved while she was breathing. So if you think about it, one good sneeze and all her front teeth would fly. And her teeth would be nothing. Like nothing would be left in her front row teeth. And yes, well thankfully she didn't sneeze. Although, if I remember, I think one tooth did fall out during that time. But yeah, I don't really remember since, whenever something bad happens to me, especially when related to dentistry or when related to dental patients, I just forget about them because it was very traumatizing and it was a bad experience. But I guess it may also serve as a warning to everyone that you have to clean your teeth, you have to brush your teeth, you have to do oral hygiene.
Knowing that I saved their teeth from completely falling out due to these severe cases of periodontal diseases. Because as you guys know, periodontics is no joke. It requires widened scientific knowledge in aspects of microbiology, pathology, and years of intensive studies. So it's not that easy, But knowing that the patients are happy, that the patients are healthy, that makes me happy as well. So all the years of study and hard work are worth it.
There are actually a lot of instruments and equipment used for periodontics.
Those instruments have different classifications, like periodontal probes, which are used in measuring the depth of periodontal pockets.
However, in my experience of being a clinician, you can actually just select a small set of instruments that fulfills all the requirements.
explorers, periodontal endoscope, scaling instruments, root planing and threading instruments, instruments for cleaning and polishing tooth surfaces like after scaling.
The main purpose of the instruments that we use is to remove the plaque and the calculus, which are the major causes of the periodontal disease progression.
Periodontists also use common surgical instruments like surgical blades, forceps, needles for suturing, and the others.
Personally, I am proud to have performed notable procedures such as regenerative treatments for restoring bone and tissue loss.
I've done dental crown lengthening, which is for excess gum and bone tissue reduction, and pocket reduction. To enable you guys to understand more about pocket reduction, there's this periodontal disease that destroys supporting tissue in bones, causing pockets to form around the teeth. These deepening pockets accumulate bacteria, which may spread under the gum tissues and may lead to bone and tissue damage. Reducing this pocket is the primary aim of the said procedure.
Gum graft surgery for repairing gum recession, and dental implants for replacing damaged teeth.
I haven't been practicing as long as the others, so I've only mainly done scalings, and that's about it.
So we have biomarkers. They serve as early detection devices for periodontal diseases. They are objective indicators for changes and responses of the body, making it easier to give appropriate therapeutical interventions. So example of media used to collect biomarkers include urine, saliva, serum, and many more. Moreover, we also have biosensors used to detect biomarkers for periodontal and peri-implant diseases. However, despite the many significant breakthroughs for the early detection of the periodontal diseases, we believe that biosensors should undergo further clinical trials before making it available for a wider population.
The field of periodontology has definitely come a long way in terms of improving your treatment and management of a particular disease. So some advancements nowadays that we currently been doing here in the lab is that we can now easily identify groups or individuals susceptible to a particular disease and subject that individual to your vaccination even before the disease could manifest itself. So another thing that I've heard that they're working on is the drug called Resolvin. So Resolvin is basically what it does is that it reduces inflammation by decreasing the ability of periodontal tissue to recruit neutrophils to the site of inflammation. So it does this by reducing the production of cytokines and reactive oxygen species that would have otherwise caused your inflammation.
For the next one, we have tissue engineering and treatment of periodontal diseases. I think it was developed by Dr. Charles Vacan. So in his proposal, a combination of triad cells, signaling molecules, and scaffolds were introduced to a specific defect site to induce cell regeneration. This concept was then used in 1976 by Dr. Anthony Melcher as the basis of his work on cell barrier principle that has paved the way for its application in periodontology. So lastly, we have nanotechnology in treating periodontal diseases. I think as early as 1970, nanotechnology has been used in dentistry, particularly in microfillings. Since then, nanomaterials have been introduced and incorporated into the field of periodontology. So some notable examples of these would be nanomaterials including bioactive glass, titanium nanotubes, coated dental implants, nanoceramics for bone regeneration, nanomaterial for the regeneration of periodontium, metallic nanoparticles in the form of toothpaste and mouth rinses for the control of oral biofilm, and then lastly, nanoparticles for local drug delivery.
Good thing you mentioned it. So periodontal disease or gum disease is a result of bacteria and plaque, a sticky, colorless film that forms in between the mouth, specifically between your gums and teeth. So as this bacteria grows, the gum surrounding the tooth becomes inflamed, so tooth loss is often attributed to untreated periodontal disease as it causes the gums and surrounding bone structure to deteriorate, resulting in the tooth to be the need for the tooth to be extracted.
Periodontal diseases are in fact associated with several other diseases. For example, osteoporosis affects the density of the bones that hold your teeth. Consequently, the teeth will no longer have a solid foundation, thus leading to tooth loss. Second is pneumonia, which is possibly due to the bacterial blooms in your oral cavity being aspirated into the lung.
So there are two general types of gum disease. We have your gingivitis and we have your periodontitis. When we talk about gingivitis, this is basically characterized by red, swollen, and bleeding gums. So it's the milder of the two types since patients more or less experience less discomfort. So it can be treated naman either through improving your oral health habits or visiting your local periodontist.
Well, there's something we call peri-implant diseases, which are anti-inflammatory conditions affecting the soft and hard gum tissues around dental implants. Bacteria builds up on the base of the implant beneath the gums. The tissue becomes damaged, and if not caught early, the underlying bone structures below the implants may also become destroyed. This is classified into peri-implant mucositis and peri-implantitis, in which the former may lead to, but that can be successfully treated and reversed if caught early.
Now, when we talk about periodontitis, this is a type of periodontal disease that comes as a result of untreated gingivitis. So what happens is that the presence of plaque basically allows bacteria to grow below the gum line. So plaque is the breeding ground for bacteria which produces toxins which trigger a chronic inflammatory response. This causes the body to attack its own cells and the bones supporting the teeth, causing it to be degraded. So during periodontitis, the pockets of gum and bone tissue are eventually destroyed, causing the tooth to eventually be loose and come off.
And lastly is cancer. Actually, in a study conducted by Mayo Clinic, it is proven that men with gum diseases were 30% more likely to develop leukemia, 49% more likely to have kidney cancer, and 54% more likely to develop pancreatic cancer. So when we say that you should take care of your gums, you should also take care of your overall well-being.
Well, of course, you have to brush your teeth. Brushing your teeth after meals is essential as it helps remove food debris and plaque that is trapped between your teeth and your gums. You all know how important brushing your teeth is.
It is also important for patients to know and understand their risks because factors like age, smoking, diet, and genetics are all important to look into as they can increase your risk for periodontal diseases.
Use some floss. Flossing at least once a day is a must, as through flossing, you're not only able to reach spots with your toothbrush that you can't reach, but you'll also remove food particles and plaque between the teeth and along the gum line.
It is important that patients consult their periodontists for them to be able to look into their teeth, plaque level, gums, bites, bone structure, and other risk factors for periodontal diseases. I believe that this is the key for identifying and preventing gum diseases, thus leading to optimal oral health.
Swish with mouthwash. Gargle. Mouthwash is mainly used to reduce plaque and get rid of food particles as well as residue that brushing and flossing miss. So if you can't do those three,
it was pretty hard. This pandemic really took a toll in the field, especially since most periodontal techniques involve aerosol generating procedures. But with the guidelines given by the PDA, I suppose we've been able to give more of the care that our patients deserve.
As periodontists really have to adjust to the current situation of the COVID pandemic by following the protocols given by the Philippine Dental Association.
Personally, I've adapted to using PPEs.
And in addition to wearing PPE, We also had to improve environmental infection control by regularly sterilizing and disinfecting the room and equipment we use.
Um, it was really uncomfortable at first, PPEs. I felt suffocated by it during the first times I've used it, being so wrapped up, so bubbled or so. I've applied using this extraoral vacuum. I've adapted to using that. At first, it did kind of seem to limit my working space. I kept hitting it with my hands. I didn't know how to position my hands with it in the way. But it's something we had to do. It's something we had to adapt to since it does lessen the aerosol suspended in the air.
As we all know, this pandemic has led us to be more careful and follow more safety precautions like wearing PPE and such. But other than protecting ourselves from contracting this COVID-19 virus, it is also equally as important that we take into consideration the welfare of our patients.
First of all, we can't have COVID 19 entering our clinics because this will endanger everyone, the staff and the patients. Because of this, we send our patients waivers prior to the appointment to ensure that they tested negative from the virus and are free from other related diseases before scheduling them for one.
So in order to ensure that, avoiding overcrowding in accordance to the social distancing protocols, we ask our patients prior to the appointment to classify the purpose of their appointments, whether it is non-urgent or if they are in need of emergency care.
And they are also advised to observe social distancing protocols while in the clinic and to wear PPE for their protection.
In that way, the scheduling of our patients is more organized and safe while ensuring that all our patients get the treatment and care that they need.
Make sure you know what you're going into because once you're there, it's hard to leave. I mean, you can still leave, but it's just like you're just wasting all those years you've spent learning the particular program.
The journey to being a periodontist is really a long, difficult ride. It's really super hard at first, with the workloads of being a student and with your personal life and other matters. It really is hard to maintain and balance everything.
You should always explore your boundaries. It can be encapsulated in the Latin virtue, magis, or more. It means you simply have to do more, give more, and be more, not just for yourself, but also for your patients, the people you're tasked to serve.
Make sure that when you're there, you're already decided that you're willing to push through the program, you're willing to do all the tasks, all the activities, and make sure that you will not give up because it will really get difficult. So just make sure that you're willing to take that path. Make sure you're already final with your decision. Yes.
But once you put your heart and mind into it, everything will work smoothly. Just remember to always put yourself first.
Personally, I would advise you to balance your time for work and yourself. I think that time management is really essential in studying dentistry and specializations such as periodontics.
Just don't be scared to fail. Failing is natural. We're not perfect.
In studying, you have to grow as a person not just academically, but also in terms of your mental health and social life.
Don't be afraid to fail. But if you do fail, recover from it well.
Headstrong studentistas, your journey has just begun, but always remember that your whys will lead you in your way to bringing back one more smile, one tooth at a time.
Don't take periodontology. Nah, I'm just kidding. Just focus on your studies, man. Just complete it. You have to complete, be yourself. If you really want it, then do it. But if you don't, then
myself. So good morning. I am Alexander Galvan, a first-year Doctor of Dental Medicine student from the UP College of Dentistry, batch 2026. And today we would be talking to Dr. Alexander Galvan, a general dentist and an alumnus of the UP College of Dentistry, batch 1996, about the dental discipline that deals with gums, periodontics. So before we would start the interview, can you quickly introduce yourself to us?
Hi, I'm Dr. Alexander Galvan. I am a general dentist practicing in Ontario, California. I graduated from the University of the Philippines College of Dentistry in 1996. I came to the US in 1997 and started practicing in 1998. This will be my 22nd year in general practice here in the United States.
All right. So let's first start with the reasons for you choosing the dental profession.
Dentistry has been a part of our family. I am a third generation dentist. My grandfather was a dentist, and so it was my father. They were five out of six siblings who were dentists in their family. And in my family, three of us brothers are dentists out of four siblings.
Okay. So what are your experiences while studying dentistry which you can impart to us?
Going to the top university of the for dentistry in the Philippines had been a challenge, but might as well has trained me to be a competent dentist when I started my private practice. Uh, it was tough going through the 4 years of dental proper in UP, but it was all worth it. I learned a lot from my teachers, both theoretically and clinically, but more so this develop I've developed the critical thinking and the discipline in pursuing the best that I can do as a dentist.
So what is your advice for us first year dental students?
My advice to you guys, I would have several advices. First is that uh, you strive hard. Your struggle in dental school wouldn't be easy, but it is through these struggles that you will learn a lot. Do not go or take the easy way out. A lot of times there'll be temptations of cheating or just taking the easy way out to be able to pass an exam or finish a project. However, these shortcuts in the long run will take its toll on the skills that you should be developing while in dental school. My motivation when I was in dental school was to seek challenges, learn as much as I can. I knew it was difficult, but then uh, that's what made me a better dentist. That's where I learned through the 4 years of dental school in UP that I've learned the minimum. Mind you that dental school won't teach you everything. However, if you make the most of the years in your dentistry or in dental school, then at least you will be better prepared once you get into the real world of dentistry when you go into private practice.
Oh, so can you impart some experiences while studying dentistry?
When I was back in UP 30 years ago, maybe some of your teachers were my teachers back then. I, as I've mentioned earlier, I've always seek challenges. So I wasn't scared of who was the terror teacher, the one who gives you the most difficult ones. Oftentimes I would present my cases with them, whoever is the toughest teacher or whoever is the head of the department. I knew it was going to be difficult, and I did have a difficult time. However, I learned a lot in that process. uh,
I was made to research what I didn't know, develop the skills that I need to know, and of course, learn from these teachers, from their experiences, and most especially the knowledge that they would like to impart to all of us. So, as I've said, in dental school, don't take the easy way out. Take the challenges, especially when taking cases, when you're in the clinics, when you start handling difficult cases, do it while you're in dental school because you always have your teachers there to guide you and to help you. Once you get to private practice, there's nobody who's gonna save you if once you have a difficult case. It all falls down to your part. But if you've experienced these difficult cases in dental school, or at least have an idea how to handle one, then it will make it easier once you face these challenges in private practice.
Okay. So can we ask you what's your type of dental practice now, or the career path you've taken?
Okay. Um, as I've said, I have a general practice here in Ontario, California, and I have a satellite location in Rialto, California. Uh, Here in California, dentistry is pretty much insurance driven, meaning patients come in because most of the procedures are covered by their dental insurance. And this includes preventative and diagnostic procedures such as exams, x rays, prophylaxis, uh, basic basic coverage of their dental insurance would include endodontics, periodontics, oral surgery, and prosthodontics and restorative dentistry. And all of these I do practice. Um, in fact, I like practicing general dentistry. Back then in dental school, I was dreaming to be a specialist. However, when I started private practice here in California in 1998, I discovered that I'd like to do all fields of dentistry. I like doing dental implants. I've been doing dental implants for 10 years now. In fact, I am a fellow of the International Congress of Oral Implantologists, and I've received enough training to be able to place and restore implants. I also like doing cosmetic work. I've done extra training on cosmetic dentistry, on full mouth rehabilitation, restoring worn down dentition. I like doing um, like cosmetic workup on patients wherein their smiles are restored after doing so much work on them.
Okay. So can you share to us some stories from your current dental practice with regards to periodontics?
Um, I think one particular patient that I could uh, think of is someone who I treated with a cosmetic makeover. When she first came into the practice, I would say sometime in 2006, she really had bad dentition and that she really wanted to improve her smile. So I did do uh, a lot of cosmetic work, particularly anterior crowns and bridges, as well as like partial dentures to restore her bite. And I still remember when I finished that case, uh, that patient was so overwhelmed with the results that she was crying on my dental chair, because she was so happy with how much she could smile at that very moment. Uh, the reason I wanted to share that story is because she had a medical condition. She had uncontrolled diabetes. And because of her diabetes, it has affected her oral health, more particularly her periodontal health. And with that, it ended up after several years, she ended up losing all of her teeth. And that she became from a fixed partial denture patient with removable prosthodontics to be a full upper and lower denture patient. Of course, she was very happy again once we were able to restore her smile with those full dentures. But it's funny because this particular patient lost her dentures like probably 2 or 3 times in a span of maybe 10 years because her dog ate it. Her she has several dogs, and she would come to me and say like, "Oh, my dog buried my denture in my backyard, and uh, I can't I can't find it." So this case is one thing that I wanted to share to you, and it's a funny story, but more so with regards to periodontics, like it is the periodontal health of our patients is very critical in maintaining their dentition. Especially, there's no value of whatever cosmetic work that you would do for your patient if you're not able to maintain the periodontal health of the patient.
All right. So, are you willing to share some challenges or difficulties in your practice?
Challenges. Being that I am a general dentist and a solo practitioner, uh, since I am the only one in the office, challenges would be certain situations where I am not able to handle it, or maybe there is some delay in 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 the procedure, and there's already other patients who are scheduled who are still waiting. I think a challenge for somebody with my type of practice is that to be able to manage your time in making sure that you finish on their scheduled appointment and that the succeeding appointments will be attended to in a timely manner. Another challenge of practicing in the United States is that this is a very litigious society, meaning that there are some people, and mind you, there will be people who are just after to sue you and find fault from you. That's why it is really important that you are up to par when you're practicing. I am very strict in my continuing education. I'm very strict with the trainings that are required by any of the monitoring boards for me and my staff. I'm diligent in researching what the standard of care that is necessary for my private practice. I do not rely on what I've already learned in the past or from my 20 plus years of experience. Every day is still a learning opportunity for me. So with this, I am blessed that I still have a flourishing practice. I have a good sized number of patients who see me regularly. I work 5 days a week. I have able staff in my support, my auxiliaries, my hygienists, and assistants who help me with my responsibilities here in the office.
Okay. So, what has been your experience during this pandemic?
Here in California, we were locked down for 2 months, from March to May, and the California Department of Public Health only allowed dental office to reopen for limited services in May. During that time, I took the free time that I had taking online webinars. I must have taken, I don't know, countless hours of webinars. And also, I took time researching what should be the proper protocol in when I reopen my dental office. As you know, that we dentists are at high risk with regards to this COVID-19, given that it could be spread through aerosols, and we work with aerosols every day in dental practice. I've attended a lot of webinars and read articles and researches, especially that this is such a new disease and there's so much to learn about it. I am glad that when I reopened my practice in May, I was confident that I had the proper equipment, I have the proper protocol, and the proper training for me and my staff to be able to handle our our patients from a day-to-day basis. You need to unmute yourself, Lance.
Okay. So, what do you like about the profession that encourages you to continue this path despite the present pandemic?
Being a dentist, I am able to help my patients not only with their oral health, but more so with their general health. We know that the mouth is the pathway to the body, and that if there is an unhealthy oral cavity, it affects the whole body itself. Unfortunately, a lot of people do not see that importance. And during the 2 months that I was not able to see my patients, I have seen the severe deterioration of some cases. Some patients who just needed fillings prior to the lockdown, they ended up needing a root canal. And worse, having their teeth pulled because it wasn't attended to during the lockdown. Um, Also, I've seen that because of the fear of people going back to the dentist, or more so just going outside, has prevented them from going to their dentist and having their dental concerns treated, which, as I've said, ends up in a worse situation wherein the patient would lose one or more teeth, wherein it should have been we were able to save had it been treated accordingly.
So, with that, what is your most memorable experience as a dental practitioner?
uh, I think being able to bring smiles back to my patients. I see patients from ages 1 to 99, and being be able to attend to their needs, from a little 2-year old who allowed me to see their teeth and brush it, to a 95-year-old patient who I had to make dentures, full upper and full lower dentures. The fulfillment comes when you have a happy patient.
Okay, so lastly, what is your advice for us to become the best dentist we would be in the future?
My advice to you, the first year dental students of UP, is strive hard, study hard. The sacrifice that you will give this next 6 years will be all worth it. Learn from your teachers, do better, accept challenges, and do not rest on your laurels. Such achievements doesn't matter when you're not able to give good service to your patients.
Okay, so with that said, thank you so much for accepting our interview, and we hope you are safe with you and your loved ones. God bless.
Thank you. You take care too.